Hello, my name's Natalie Whitten. I'm a consultant in the emergency department here at the Great Western Hospital. Sadly, we see a large number of patients who come here really frequently, attend the emergency department and urgent treatment centre, and we call these patients high impact users, and some of them can come to us more often than 5 times in a year. There are about 1,100 high impact users at GWH, and they equate to about 9,000 visits to the hospital every year. And there's lots of reasons why these patients feel that they need emergency care. So this could be social issues like alcohol or drug abuse, difficulties with accommodation, mental health conditions such as depression or recurrent self-harm, or just reoccurring medical pain or symptoms. But our emergency department is really busy, and so whilst we still care for every single person that comes through our doors, those patients that frequently attend would often be better treated through another avenue. So ED is really good at treating emergencies, but it's not the most appropriate place for a patient with a recurring problem that's happening again and again. So we know that these high impact users are at increased risk of dying early, that they have worse health overall, and that these problems can often impact on their well-being, their jobs and their livelihood. And so this is why I've made it my priority to offer these patients the care they need, and in the most appropriate setting. So that can be anything from better pain relief to support with alcoholism so that they don't end up in a crisis and needing our care in emergency department. So we start just by writing to them, explaining we've noticed they're coming in to see us a lot and that we're sorry they felt unwell, but we ask them to consider what services they might need. So that can be referrals from their GP, community services, those better equipped to meet their needs, such as help with drug and alcohol dependence or support from the local authority with housing. But it can be hard for those patients to realise that they need a better solution and that ED is not always the right place for them. But we make a commitment to all of those patients to support them until the right help is in place. So what we do is we build some special care plans and we support them while they pursue other options. So for an example, I recently supported a really lovely young lady who was frequently coming in due to self-harm, and we work with these amazing local community art and gardening groups, and we've helped this patient forge stronger community links, and she's then had the strength to access self-referral to community-based psychological support, and she's now doing incredibly well, and she comes to us much less often in the emergency department, but more importantly has an improved quality of life. So I'm really proud that working with these patients, we've managed to reduce them coming to the emergency department by 57% and actually being admitted to hospital by 78%. But most importantly, we give them the care they need and the dignity in the quickest and the safest way. And this is partnership working at its very best, and there's much more support available for the members of our local community. So I'm really grateful and really thankful for all our colleagues who help us support this life-saving work for our patients.